So let's talk about how we fix some of these things. So basically, the bottom line is that you just want to restore how the shoulder is normally supposed to work, right? So the shoulder is a complex area, but it's actually quite an elegant solution, and it's, when it works properly, it does the job very well. And you can also see that what you don't want to get tied down to is in where's the pain or what specific structure, because as we sort of demonstrated with a lot of this stuff, the same sort of areas of pain can be caused by all kinds of different stuff. So it's not so much that you only want to treat what's painful, but you want to kind of fix the mechanics and say, why is it overloaded in the first place? Okay? And so to do that, there's basically sort of 3 steps. And this is sort of what our approach is, or what my approach is. And another important thing that this might be kind of hard to see is these steps kind of have to be done in order. If you try to skip steps, you get ahead of it, it's just not going to work as well. You'll understand why as we go through this. But the first thing, step number 1, is just restore normal tissue health. Okay? So what we mean by that is if there is a injury or inflammation, you got to get that taken care of first. Because if there's pain, the body's going to do all kinds of funky stuff so that tissue is unloaded or it's not becoming painful. Okay? So that would be more of your acute type of stuff. But the other thing with this tissue health is that scar tissue that we talked about. Right? We spend 5 or 10 minutes at least talking about the importance of that. And this is a really, really common thing to happen all over the body, but especially with shoulders, just because of the repetitive use that happens. So remember, if you have that scar tissue in there, that's restricting all that sliding, okay? And it's going to have an effect on your normal strength and your normal flexibility. So a lot of times what people will try to do with a shoulder problem is say that rotator cuff is weak, let's strengthen, or that pec is tight, let's stretch it. Great intentions, and a lot of times it has to be done, but if you're stretching or strengthening a muscle that's full of this junk or this scar tissue, I mean, it's going to be a hard road. It's going to be very limited on what you're going to do. So that's an example of skipping steps. It's not that those things are bad. It's just that if you get some of the stuff in there, you kind of got to go through that proper order of operations. So let's talk about this for a minute. So to get rid of the scar tissue, unfortunately there's a limited sort of list of things that you can use to do this. Things like stretching, things like exercise. This doesn't touch this stuff. Okay? One of the things that we do in our office that I find really effective is this thing called active release technique, or ART. Anybody heard of this before? Yeah, okay. So let me give you like a 4-minute crash course on this. If anyone has any questions, we can talk about it, but just for anyone who doesn't know exactly what the heck this is or how it works. So first of all, from a treatment technique, this is relatively new. It's been around for maybe 20 years, but in the last 10 years, it's really growing in popularity, and it's really becoming one of the kind of that gold standard go-to things for a lot of this repetitive strain type of chronic issues for soft tissue stuff, because it deals with a lot of this scar tissue. So if we look at our picture over here, remember we got this basically hunk of scar tissue in through here. So when you're stretching or strengthening, basically what you do is you're working everything around it. It's kind of avoiding the scar tissue. What ART is you can think of it as a very focused, very specific kind of active massage. Massage in the sense that it's hands-on sort of thing, active in the sense that we're sort of moving tissues around as we're applying treatment. So you can think of this kind of as we were to shorten the muscle. So if we were just as an example, looking at the bicep here. If you started a shortened position and try to sort of stretch that out, and if you apply a pressure in the opposing direction, so the muscle is being pulled this way, and we're pushing this way, we can sort of feel with our fingers where some of this stuff is, and you can feel where things just aren't moving properly, right? Anyone ever feel where something's just a little bit bumpy or doesn't feel smooth? Right? A lot of times this is some of this scar tissue. So if you're pulling one way and pushing the other, basically we're just coming along the lines of these fibers, and you can sort of break this up a little bit. So it's not so much that we're getting rid of it completely. What we're trying to do is this stuff, the scar tissue going in this direction is good. Remember, so this stuff isn't necessarily bad. It's just that if there's a lot of it or it builds up, it can start to affect function. So we want to keep the stuff that's connecting the fibers together, but it's those cross fibers that go this way that are binding everything together. So by moving things relative to one another, we can sort of get in there and get fibers to slide on each other and kind of work that out or break it up a little bit. The same thing as if we would have sort of scar tissue in between two different muscles. If we stretch one muscle while we're working that area, while we're sort of slackening another muscle, you're getting one muscle to move while one muscle is moving in maybe an opposite direction. So it's relative motion. We're trying to just restore the normal movement. And a lot of times this stuff works really fast as far as breaking some of this stuff up. Usually within sort of a visit or two, there's a difference as far as how everything's able to move. Not that it's going to solve everything in a visit or two, but if it's going to work, it works very quickly and very effectively. Right? So that's kind of the idea. There are a couple other sort of options as far as treatment. Everyone, you know, heard of the Graston or these silver tools that people use and move stuff around?
Yeah.
Okay. So it's sort of not the exact same, but the same concept in the sense that it's trying to sort of use that tool to break up some of this stuff. And there's sort of a handful of some of these instrument-assisted sort of techniques. But like I said, the list is relatively short as far as stuff that specifically targets this, right? And I just like the ART. I've been using this for years, and I find it just works. It works very well. And the really nice thing is that if it's going to work, it works fairly quickly. It's not one of these things. Let's see how it goes for 2 months and see what happens. Usually within a handful of visits, you see an improvement. Yes. Yes, sir. Okay, so that's ART, and like I said, that's with scar tissue and stuff like that. That's kind of step one, is you need to get those tissues healthy so they have a fighting chance to kind of stretch and contract better. Now, a lot of times when you work this scar tissue out of there, now that the muscle is able to, the body can start to sort of rework or reuse these muscles because now there's not that sort of inherent limitation. If that scar tissue's been going on for a long time, or if it's the type of thing that's just really chronic in nature and the body's shutting that down, that muscle will also get deconditioned a little bit. It just hasn't been used, so it starts to get smaller and weaker. And that's when you need to get in there and start restoring strength and flexibility. Okay? You got to start with local strength first. So if this scar tissue is affecting 1 or 2 muscles, if you do kind of a type of exercise that works the shoulder in general, the body's learned to compensate fairly well for that, you know, one muscle not working properly. If you do these, what we call these functional exercises that kind of works the shoulder as a whole, all you're going to do is rework those compensations or get those same muscles stronger. You need to go in there and you need to really focus on the individual muscles. So if this is infraspinatus on the back that's weak, you need to do kind of a muscle that, or excuse me, an exercise that'll isolate that, because you need to bring that up to speed, or at least restore the normal strength so it's balanced with the other muscles, so there's a fighting chance. Okay, so it's just whatever individual muscles are, you kind of need to start there. Then, if needed, you need to do this step 3. So a lot of times, again, the body wants the muscle strong. The body's pretty smart and can do a lot of stuff on its own. It's just sort of programmed that way. A lot of times, once you restore the tissue health and if needed, restore the strength and flexibility, the body just automatically starts to work that again. And you start to see these movements being a lot cleaner and a lot mechanically more efficient. If not, you sometimes have to go in there and just retrain kind of the functional movement. So this is the idea of getting coordination. So you're doing whole sort of shoulder contact. This might be presses or push-ups, or the idea that's using the shoulder in general as opposed to isolating muscles, just to sort of tweak that last kind of 10% or get the shoulder to coordinate itself a little bit better between rotator cuff and scapulothoracic muscles and that sort of thing. So that's kind of the breakdown of step 1, 2, and 3. Now, obviously, it's difficult if someone has, shoulder pain, like we talked about, because it can be so many different things to say you need X exercise or Y exercise for this problem. There is a packet in there of just a general sort of shoulder strengthening program that we use in our office. If anyone wants to, wanted some exercise, there's a great example. If anyone's looking for more of a preventative type of thing, that's a great program. The only thing I would say is that if you have a shoulder problem, I would say just proceed with caution if you think that's the only thing that's going to sort of solve things, just because of the reasons that we talked about as far as everything's a little bit different, and it's really, not that it's going to hurt it, but it's going to be a long road if you're trying to do that and the tissues aren't cleaned up as far as that scar tissue. Yeah, so prevention, sort of what I was just talking about. With prevention, you kind of work your way backwards a little bit. So if everything's working good, including some shoulder exercises, sort of global shoulder exercises to sort of keep those functional patterns is great. And even doing some kind of local strengthening exercise, some of these rotator cuff exercises similar to what I have in there, great to just keep the strength up. And a lot of times, especially if it's more of a repetitive thing with occupational or athletically, I mean, it's bound to get some buildup of this scar tissue. So a lot of times what has to happen if you're just using that shoulder a lot is just some maintenance work and getting some of this sort of scar tissue stuff sort of dealt with from time to time, just because it has a tendency to build up. And if you do that before it kind of blows up and becomes a problem, it's just better. Prevention is better than cure, as I say, right? Any questions?